Hi everyone, I'm Terry Gruca here at KVUE. Happening right now, Austin City leaders giving an update on the coronavirus, COVID-19 here in Central Texas. Mayor Steve Adler is there among them. Let's listen in.
It's great to have this incredible regional unity here today on to face together the challenge of COVID-19. Our best enforcement in this challenge is our responsibility to each other. And this gathering of leaders from across Central Texas shows an incredible sense of responsibility to one another. COVID-19 depends on us to pass it from person to person. We have a small window of opportunity in which to flatten the spike of infection by taking aggressive steps right now. So, over the next days and weeks, I am calling upon our community to be strong, to be unified in maintaining social distancing. We will find new ways to work, play, and worship together. We will find ways to stay connected while preventing the spread of COVID-19 in our community through social distancing. So today, I have signed an order to stay home and work safe. The details of that order will be coming out over the course of the next hours so that people will be able to take a look at the order themselves and understand what it means for them. But at the end of the day, what it means is that we're asking our community to stay home to the greatest extent possible. We've identified specific industries and ways those industries could stay operating because they are essential. But if it is not an essential activity or an essential business, we're asking folks to stay home and to stay safe. So with that, I would like to introduce Dr. Escott to come up and brief us on the facts underlying this order and why we've gone to this aggressive but necessary action so that folks can stay home and stay safe. Dr. Escott.
Good afternoon. I'm Dr. Mark Escott. I am the Interim Health Authority for the City of Austin and Travis County. As of today, our jurisdiction has 86 confirmed cases. However, due to modeling that we've seen, we certainly suspect even at this stage we have many more than that. We know that we're challenged by testing. We know that we're challenged by getting folks through and getting results in a timely fashion. But what concerns us the most right now is the modeling that we've seen with our partners at the University of Texas at Austin. That modeling suggests that in the short term, in the next 3 to 4 weeks, our hospitals could reach capacity. That modeling suggests to us that if we put schools back in session, if we turn the businesses back on, if we allow people to go back to restaurants and bars and businesses today, that by May, we will need to be able to provide more than 20,000 hospital beds a day for our community alone. And I bring this up because we have to forecast a little bit. The lessons learned have been loud and clear from China, from Italy, from Seattle, from Washington, from New York. We cannot wait until the hospitals are already overrun to make decisions and act decisively to prevent this spread. Now, we've made difficult decisions before. Closing South by Southwest, the Spring Festival, closing restaurants, dining rooms, and bars and businesses. But these decisions are not as difficult as the ones that we really want to prevent from having to make. Those decisions are, which member of our healthcare community gets personal protective equipment? Who gets masks? Do we give it to first responders? Do we give it to hospitals? Do we give it to nursing homes? Other decisions that are even more difficult, when we have scarce resources, if we were to run out of ventilators and ICU beds, we have to make difficult decisions about who gets the ventilator or not, who gets the opportunity to survive or not. These are decisions that are already being faced across the globe by communities who are already at war with this virus, and one that we can prevent, or at the very least delay substantially, until we can be more prepared to fight that battle here. Today in the City of Austin and Travis County, We have enough hospital beds, we have enough ICU beds, we have enough ventilators to get us through the next 3 to 4 weeks. But if we don't take action today, we are going to run out, and we're going to run out soon. It's important for us to also remember that when our friends and our colleagues and our families are already at war in California, in New York, in Washington State, we should be at war also. We need to have that war mentality. We must band together right now to ensure that we are strengthening our defenses and that any excess that we have, we are sharing with those communities who are already in battle. We can't take chances right now, not when we are still identifying additional bed capacity, additional ventilator capacity, when we are still in the process of ramping up testing, when we are still trying to identify personal protective equipment that our healthcare providers and our first responders need to protect themselves and their families from this virus. I will not ask them to sacrifice themselves because we failed to act. We are acting today. And for these reasons, I recommended to the mayor and the judge that we transition to the stay-home order effective immediately. Now, over the coming days, the University of Texas is going to share some of the modeling information that we have seen. And you're going to see some numbers about social distancing. Right now, we believe before today that we've been at 50% social distancing through the actions that we've already taken. That has bought us valuable time, and we acted early. Now we're hoping that this action will get us at least to 75%. But I want to be very clear with the members of this community. We need to be at 90%. And that takes you. That takes all of you making individual decisions to stay home, to work from home, and to only go out if you need essential things. If you don't need essential things, you need to stay home, you need to be with your family, you need to connect with the world virtually. Further, I've recommended to school districts, private and public schools, that they remain closed for the remainder of the semester. The modeling that I mentioned, the modeling that will be shared in the next 2 days, indicates very clearly that that is a basic and necessary step to substantially mitigate this threat. If we don't do that, we will not be effective at preventing undue death and surge in our healthcare system. Now, it's important to recognize that some good decisions have been made along the way. And I want to recognize President Trump for his early and decisive action to restrict China travel. But we will not be judged on our early actions in this outbreak, in this crisis, in this war. We will be judged on the totality of our decisions. And therefore, we have to continue to use science and medicine to help guide and inform those decisions. It's critical right now that we stop acting independently as cities and as states. It's critical that we stop acting right now as Republicans and Democrats. To be successful as a nation in battling this war, we have to do it as one country. We have to continue to make decisions and take decisive actions now that will strengthen those defenses. We have to ensure that those of us who are battling smaller battles at this stage shore up those defenses so that we can reinforce those who are already at war. We have to continue to choose strength over fear in the face of adversity. But to do this, we have to do it not as individual cities and states, but as one United States. Together we can save thousands of lives in America. We can save thousands of lives right here in our community. But to do this is dependent upon the whole community. That's staying home. That's using good hygiene. That's supporting those that still have to work. Our first responders, our healthcare workers, our sanitation employees. Those essential employees are going to be hit hard. They're going to have to work hard to support the rest of this community. It's up to our entire community to support them. I'll now ask Dr. Lori Palazzo, who is the Health Authority for Williamson County, to come to the podium.
Thank you, Dr. Escott. I can't emphasize enough what Dr. Escott just said. We do have to work together. This is important for us to do this and to make this move, that we all do stay home and stay safe. As you may know, 8 of the 10 deaths in the United States have been in persons over the age of 65. In Williamson County, we have 74,000 residents who fit into this category. Our goal is to protect all our residents, but especially this vulnerable population. That's why we've sent out control orders with strict infection control for all the nursing homes, assisted living facilities, retirement communities. And that's why I stand behind this decision to go even further with stay home, stay safe, to protect everybody, but especially our vulnerable citizens. Thank you very much for helping us, and please, let's all work together in a united front to keep everyone safe. And now, Judge Gravel from Williamson County will come speak.
Good afternoon. I'm Bill Gravel, the Williamson County Judge, and I want to say first thank you to those that are a part of the Central Texas community and the region and the collaborative effort that we've used in working together. I especially want to say thank you to Judge Eckhart in Travis County and how we've been able to partner together, because we have cities that cross county boundaries. I want to say thank you to Mayor Adler, because we have Austin and Williamson County and Travis County. I want to say thank you to Mayor Morgan in Round Rock, who is in the same situation, as well as Mayor Van Arsdale from Cedar Park. What we're talking about today is not just a county approach, but a regional approach to fighting something that we're facing. The coronavirus knows no boundaries. It knows not Williamson County or Travis County. It knows no boundary of white or black or young or old. This virus knows no boundaries. So we must, as a community, come together and work together collaboratively. I've signed an order effective at midnight tonight for Williamson County to stay home and stay safe. During the Stay Home, Stay Safe order, you can check that out at your Travis County website or your wilco.org website and find those particulars that would pertain to you. What we're really asking for Central Texas to do is to come together and work as a region to care for those that are around us. Let's use technology in the next many weeks to communicate with our friends and to check on those. The greatest concern that I have as county judge and as a leader in Central Texas is for our individuals in our community that are alone, or perhaps they are afraid. Use this time to check on the seniors and the young and those that are alone near you. Use the technologies that we have to connect with each other. This is a time where the region comes together to be creative and innovative. And I want to say to the governor of the state of Texas, I respect you and I trust the decisions that you're making for our Texas. I understand that you haven't issued a statewide order, and I completely understand what you're doing. I know that you're responsible for 254 counties, and we're only responsible for 2. We respect your decision, we need your support, and we need your help today and in the days ahead. I'm proud to introduce to you a man who I think has been a stalwart during this time, the mayor of the city of Austin, Mayor Steve Adler.
So we've got this. We have the ability to control what it is that happens in our community. So this virus has come. It is a big deal. It's becoming more and more apparent all the time. But let me lead with just a thought and a measure of hope, which I think we can all embrace. If we all do what we can to help keep our neighbors safe and ourselves safe, then we're going to be able to weather this virus coming into our community in the best way possible. If we don't, though, the biggest challenge, the biggest risk we face is that we just don't take this as seriously as we need to, that we don't do the things that we can do right now. We don't take advantage of this real window of opportunity that is before us. If we don't grasp it and take advantage of this opportunity that we have, then we're going to get pretty much overwhelmed by the virus, and we won't be in a good place. But we get to control that. We get to decide, both individually and collectively, what's going to be happening in our community over the coming weeks. This is the challenge, and this is what we all need to do. And if you heard Dr. Escott talk earlier, it's pretty clear. We have to decrease the number of physical interactions that we're having by 90%. By 90%. That's a really big number. It's going to be pretty disruptive to people's lives. It's a real change in the way that we've been going about living until this very moment. But for at least some period of time, the challenge before us is, can we decrease those direct interactions by 90%? Because if we can, individually, if we can collectively, then we're going to be able to weather this. We'll be able to make sure that everybody who wants testing has the opportunity to be able to get testing. We can get down to 90% reduction in interactions. Then all of our first responders and healthcare workers will have all the personal protection equipment that they need. Ultimately, we'll have all the ventilators that we need in the city. We get to decide that question. And what makes this difficult is we have to decide this question now before we actually see what it looks like when a lot of people in this city are catching this virus. And a lot of people are going to get it. It's a virus like the flu. It's going to pass through. What we're trying to ensure is that everybody doesn't get it. Everybody doesn't get it at once. So what's the best way to do that? It's to stay home and to work safe. And that's the orders that we're entering here today. The best way to be able to achieve that 90% reduction is for everybody to stay home. And to the degree that you can, everybody should be staying home. Now, the orders that we have exceptions. Obviously, there's some people that are going to have to go to work because their job or their function is really essential or critical for the city and the county and the community to be able to move forward. But everything that's not essential and critical, we're going to put aside for right now to help as many people stay as home as much as they can be home. It's okay to go outside. In fact, it's probably encouraged to go outside so you don't get stir crazy in the house. Go out to walk or to jog. But when you do that, don't do it in groups. Again, reduce by 90% the direct interactions that you're having with people. You can still go out to shop, to the grocery store, to the pharmacy, to get supplies. That's okay too. When you do go shop, go out and shop alone. Don't bring the whole family with you. Decrease those interactions. Make sure that when you do go out, that first, don't go out if you're not feeling well. Don't go out at all. But if you are feeling well and you go out to shop at the grocery store, make sure that you're staying 6 feet apart from everybody that you will be interacting with. You know, I am really proud of our region acting the way that it has. Greatly appreciate the leadership of the county judge and the opportunity and the cooperation that the city has had working with Travis County. Our staffs are working with one another. We've been working together thus far with all the orders that have come out. We'll continue to do so. Wider than just Travis County, with Williamson County. It's great to see some of my colleague mayors here and others that would be here if we weren't practicing social distancing and trying to keep some people at home. But it's not just us. This same thing, virtually the same kind of orders, The stay home and work safe orders are now being put into effect in Houston and Harris County and Bexar County and San Antonio and Dallas County and Fort Worth. We see this now happening in the big metropolitan areas and the big counties around the state, because it's going to take all of us doing this together for it to be able to work. Now, we have pulled together before. We did it with the bombing. We did it with the water boil. It's one of the things that I love about this place. This one's a little bit bigger. It's going to be a little bit more sustained. But we know what's necessary. We know how good it feels to actually be able to do everything we can to help ensure that our neighbors are safe. This is my request for everybody. This is an order that's going to go into effect midnight tonight to give everybody the chance to kind of get ready for it, to close down their non-essential and critical businesses. Tomorrow we start this in earnest, although everybody that could start it today, please go ahead and do that. But this is what I want. When you go to sleep at night, I want you to count the number of people that you have interacted with over the course of the day. Think through the day, count the number of people, and see if you are successfully decreasing by 90% the number of direct physical interactions that you're having with people. We have to keep track of that number. Everybody needs to do their part in this if we're going to be successful as a community. If we do this, we're going to be able to get through this in a good place. But it's going to take all of us pulling together. We can do this. Thank you.
So as you can see, although we are practicing social distancing, we are not alone in this. We have a robust local strategy, and we're deploying it so that we can stay home, work safe. And stay home, work safe is the best way in this moment to lessen both the health and the economic impacts of COVID-19. So I just want to say thank you to all the local heroes who are meeting this challenge with all their talents, their resources, and their ingenuity. We are all in this together. So with that, I'd like to kick it over to questions.
Okay, Judge, the number of questions here. The first question is from Fox 7. I believe this would probably be for Dr. Escott.
You just heard Austin, Travis County, Williamson County leaders talking about a stay-at-home and work-safe order issued starting at 11:59 tonight. That means that only travel for essential activities. You can go to the grocery store if you need essential items, but they're urging everyone to stay home, limit their interaction with people, try to cut that down by about 90%. You also heard that we now have 86 confirmed cases in Travis County, and health authorities believe that number is much higher. We are struggling to get some of those test results back, and so we'll continue to keep you updated. But a stay home and work safe order issued for Travis and Williamson counties. My colleague, Tony Plahetsky, has been talking with city and county leaders over the past several weeks, and he's been covering this story, so I'm going to toss it over to him. But I just want to leave you with this. If you are a mom, a dad, just take care of your family. Make sure that you are taking time to really reflect on this as a family and enjoy some family time. I think, if anything, this gives us all a chance to pause and to really reconnect with what matters most. So take the time to do that with your family. Get outside, do some gardening, do some planting, do some walking, do some thinking, do some playing with your kids. What a great opportunity. And then tune in if you can occasionally to watch us. We always appreciate that. Tony Plahetsky joins me now. Tony?
Yeah, Terry, thank you for that. I do think those words are very important, and those suggestions are very important right now. One thing that was striking in terms of headlines from the news conference is that we did hear Dr. Mark Escott, who is the interim health authority here in Austin and Travis County. He has now recommended to school districts that they not return to campus for the remainder of the year. So that was also another headline coming out of this news conference. But Dr. Escott has been saying to me and to others that officials were going to be looking at modeling in terms of making their decision about whether or not to put this order in place. He did give us some, frankly, very sobering numbers, saying that if we do nothing as a community over the next 3 to 4 weeks, our hospitals could reach capacity or would reach capacity, and that by May, we would need to, as a community, have 20,000 hospital beds per day. But again, a number of exemptions to these orders that have been put in place today. Restaurants will still be able to offer delivery service and meal pickup, and there are other types of essential businesses. I've been going through the order here in the past hour or so. Of course, pharmacies will remain open, supermarkets will remain open, and I think that Travis County Judge Sarah Eckhart said it best in a phone call with reporters last night. We're not asking you to seal up your windows and seal up your doors, but as a community, this is the time. This is our window to all band together and work together and do the right thing, not only for ourselves and for our families, but our neighbors and our community. This is, they have likened this to a war, and we are now all soldiers in this war, and we all have to march in line together, according to officials at this time. Terry. Okay, and with that, we are now going to return to our regular programming here on KVUE. Please keep it tuned to us. We'll be back at 5 and 6, and of course on all of our social media channels. I'm Tony Plahetsky reporting live. Back to our regular programming.